Do you feel pain on the outer part of your elbow while lifting, gripping, or even shaking hands? You might be dealing with tennis elbow, also known as lateral epicondylitis. In this video, we'll dive into what it is, what causes it, how to diagnose it, and how physiotherapy can help you manage and treat it effectively. Lateral epicondylitis is an overuse injury of the common extensor tendon on the lateral side of the elbow. That occurs secondary to an eccentric overload of the common extensor tendon at the origin of the extensor carpi radialis brevis tendon. It's usually caused by repetitive stress, poor technique, or sudden overload of the forearm muscles. Risk factors include age, 30 to 50 years, improper ergonomics, and poor wrist posture during activities. You will also commonly see this chronic condition in other sports, such as squash, badminton, baseball, swimming, and field throwing events. People with repetitive one-sided movements in their jobs, such as electricians, carpenters, gardeners, desk-bound jobs, also commonly present with this condition. The main symptoms are pain over the outer elbow, weakness in grip strength, pain during wrist extension or lifting, and tenderness over the lateral epicondyle. Physiotherapists diagnose it through clinical tests like Cozen's test, Mills' test, and Maudsley's test. Cozen's test. The elbow is stabilized in 90-degree flexion. The therapist palpates the lateral epicondyle, and the other hand of the therapist positions the patient's hand into radial deviation and forearm pronation. Then the patient is asked to resist wrist extension. The test is positive if the patient experiences a sharp, sudden, severe pain over the lateral epicondyle. Mills' test. The patient is seated with the upper extremity relaxed at the side and the elbow extended. The examiner passively stretches the wrist in flexion and pronation. Pain at the lateral epicondyle or proximal muscular tendinous junction of the wrist extensors is a positive sign for lateral epicondylitis. Maudsley's test. The examiner resists extension of the third digit of the hand while palpating the lateral epicondyle. A positive test is indicated by pain over the lateral epicondyle. Here is a physiotherapy treatment plan. Pain relief phase, 0 to 2 weeks. In this phase, the goal is to reduce pain and inflammation. Rest and activity modification, cryotherapy, 15 to 20 minutes, 3 to 4 times a day, bracing or tennis elbow strap, electrotherapy, ultrasound, TENS, shockwave therapy, and soft tissue massage. Stretching phase, 2 to 4 weeks. Improve tendon mobility, muscle length, and begin tissue remodeling. Wrist extensor stretch, range of motion exercises can be done in this phase. Strengthening phase, 4 to 8 weeks. Progressive strengthening is vital to restore function and prevent recurrence. Eccentric wrist extension exercises, grips are strengthening with soft ball, resistance band exercises can be used. Functional training and ergonomics, 8+ weeks. Now it's time to return to full function and prevent relapse. Ergonomic training for desk workers, technique correction for athletes, and gradual return to sport or work can be done in this phase. While these exercises and treatments are incredibly effective, it is important to remember every case of lateral epicondylitis is different. That's why consulting a qualified physiotherapist is essential. They will assess your unique condition and create a personalized treatment plan tailored to your needs, lifestyle, and goals. If you found this video helpful, hit like, subscribe for more physiotherapy insights, and share it with someone who needs it. See you in the next video. Stay active, stay strong.